Welcome back to RN Toolkit. In this lesson, we'll explore how the aging process affects the integumentary system. From thinning skin and fragile vessels to nail and hair changes, you'll learn how these age-related shifts impact nursing care and patient outcomes.
All right, let's break this down by starting with a simple side-by-side. Think about young skin. It's like a brand new rubber band. It's resilient, it snaps right back, and if it gets a cut, it heals up pretty darn fast. But aged skin, that's a whole different story. It's more fragile, healing takes a lot longer, and its ability to protect us and control our temperature just isn't what it used to be. This contrast is really the foundation for everything we're about to cover. So here's our game plan. We're going to start by going under the hood to see what's changing in the skin's layers. Then we'll look at the add-ons, the hair, nails, and glands. And most importantly, we're going to tie all that science back to the real world, your clinical assessment priorities that you'll use every single day. Okay, let's peel back the layers. Literally, we're going to start at the very top with the skin's first line of defense, the epidermis. Now, this is pretty interesting. You'd think that as the epidermis thins out, you'd have fewer layers of cells, right? Well, not exactly. The skin does get thinner, and cell turnover slows way down. But the number of cell layers actually stays about the same. What happens is the cells themselves get bigger and, well, a little more irregular in shape. At the same time, those pigment-producing cells, the melanocytes, start to decrease, which has its own set of effects we'll see later. Let's go a little deeper into the dermis and the subcutaneous tissue. This is the skin support structure. It's mattress, if you will. With age, that mattress starts to wear out. You've got less elastin for bounce, and the collagen fibers get all tangled and tough. The blood supply isn't as good, making capillaries fragile, and that nice layer of fatty matting starts to thin out, especially in the arms and legs. So that whole process with the collagen fibers getting stiff and tangled, it has a name, elastosis. It's the #1 reason skin loses its pliability and why wrinkles start to form. And no surprise here, years of sun exposure puts this whole process on fast forward. Okay, now let's shift gears and talk about the skin's appendages. We're talking about the glands, the hair, and the nails. Each one gives us another piece of the puzzle in understanding the older adult. So when the glands slow down, you get hit with a double whammy. First, the oil glands, or sebaceous glands, produce less sebum. The result? That classic, dry, sometimes itchy, skin. Second, the sweat glands kind of go on strike. There are fewer of them and they don't work as well, which means the body's internal thermostat is on the fritz. It's much harder to cool down, which is a huge risk for hyperthermia. And what about hair? Sure, graying is the most obvious thing. That's just less melanin being produced. But it's so much more than that. Hair thins out almost everywhere. And then you get this strange paradox where, in some places, it can actually get coarser. Think men's ears and eyebrows or women's facial hair. It's a total change in distribution and texture. Whoa, just look at that number for a second. A 30 to 50% slowdown in how fast fingernails grow. That is a massive change. And it ties right back to what we said earlier about reduced blood flow to the nail bed. Less circulation means everything just slows right down. And because that growth is so much slower, the nails themselves change. They can get dull, brittle, and thick. You'll probably see more of those vertical ridges, which can even cause the nail to split. Toenails are especially a problem. They can get really thick, which is a condition called hyperkeratosis, and that makes proper foot care absolutely critical in your patients. Okay, here's where we put it all together. This is the most important part. We've talked about the science, the why. Now let's talk about the so what. What does this all mean for you at the bedside? Remember how we said the dermis gets thinner and loses its fatty cushion? Well, here is the direct, visible consequence of that. The tiny capillaries right under the skin surface are basically left without their support network. This makes them incredibly fragile and super easy to damage. And that fragility leads to something you are going to see all the time. It's called senile purpura. These are those dark purple splotches, usually on the forearms, that can show up after even the slightest bump. Now here's your key takeaway for assessment. Don't panic. This isn't usually a sign of a major bleeding disorder. It's an expected finding. It tells the story of those fragile capillaries. Let's quickly walk through the dangerous domino effect that leads to a pressure ulcer. First, that fatty padding over the bones disappears. So now, bony areas like the sacrum and heels are incredibly vulnerable. Next, prolonged pressure squishes the deep blood vessels, causing clots and cutting off the blood supply. And the final step? The tissue dies. That cellular necrosis results in a deep, hard-to-heal ulcer. So let's just boil this all down to the absolute essentials. What do you need to remember? 1. Healing is delayed. 2. Sensation is impaired, so your patient might not even feel an injury. 3. Sub-Q injections are absorbed slower. And 4. They overheat way more easily. Every single one of these points needs to be front and center in your care planning. So let's bring it all home. How do we turn all this science into smart, compassionate care? Here's what that looks like in the real world. Think of this as your mental checklist. First, you observe. You're looking for that thin, dry skin for any purpura. Then, you palpate. You're feeling for temperature and elasticity. Next, you anticipate. You're thinking ahead about the risks, like skin tears and ulcers. Then, you protect. That means gentle handling and preventative measures. And finally, you educate. The patient, the family, everyone involved. It's a full circle of care. And that's really the core message. Look, anyone can see wrinkles, but a great nurse sees the story behind the wrinkles. They understand the loss of collagen, the fragile blood vessels, all of it. When you understand the why, your assessment becomes so much more powerful than just checking off boxes. It becomes a true clinical skill. So I'll leave you with this question to think about. How is what you've learned today going to change the way you walk into your next patient's room? Because applying this knowledge is what's going to make you an insightful, effective, and truly compassionate nurse. Thanks for tuning in.